We are back with Lilly Ghalichi, who had a filler fiasco like no other. Thank God I've never seen this to this extent. All right, she was helped by the UCLA Emergency Filler Response Team, and joining us from that team now is Dr. Kelsey Roelofs. Doctor, welcome to the show.
Thanks so much for having me.
What a great thing that you have at UCLA in the heart of West LA, because there's a lot of injecting going on in West LA. And I know your background, you're trained in ophthalmology for issues particularly around the eye, but fillers in general. That's part of what you do. And you know, when we're talking about arterial occlusion, the biggest thing that we fear is blindness, because potentially with a filler injection, you can get blindness. So that being said, tell us, how often are you called in to triage these potentially very serious problems?
So fortunately, we only usually see one, occasionally two complications like Lilly's per month that are true vascular occlusions. And that's really great, for patients, because it truly is a very rare complication. But the flip side of that is its rarity makes it very challenging to study from a scientific standpoint and to really provide research and evidence to, optimize the management of these types of complications.
And I'm sure you'll agree, Doc, that time is of the essence when you're talking about vascular occlusions. You can't waste time because every second counts. You want to limit the damage of blocked vessels. We want to open those blood vessels up. So we talked about dissolving agents. Would you agree with these treatment modalities? And would you add anything else?
Yeah, I think because of the lack of evidence, a lot of the recommendations in the literature are based on anecdotes and personal sort of experience. And my sort of personal understanding of filler complications related to vascular occlusion is taken from some of the cardiology literature. And I think it's very well defined there that time to reperfusion is a tremendously important metric in terms of limiting the damage that occurs after an ischemic insult. So I completely agree. Time to treatment is really important in these types of scenarios. And for me anyways, the mainstay of treatment really is to try and dissolve the product that's lodged in a blood vessel and is causing the ischemia. So hyaluronidase is an enzyme. It's naturally found in the body, and you can inject it. Personally, I find that injecting it in a diluted form is helpful for two reasons. Number one, the excess volume that you're injecting when you dilute it in, say, 10 cc's of normal saline really increases the pressure within the tissues and helps to push that enzyme into the blood vessel where it needs to get. And number two, it's sort of, increasing your net, your fishing net, because you really do need to get that enzyme where the filler is lodged. And if you use a larger volume, you have a much better chance at getting that enzyme where it needs to go.
All right, Lilly, back to you.
Thank you, Dr. Kelsey.
What's the lesson you want others to take away from your ordeal?
Yeah, I would say the number one takeaway that I've learned, and I hope I can share and spread that message, is don't do unnecessary procedures unless you are absolutely sure that this bothers you and you can't go on looking this way. It's not worth the risk, because everything comes with a risk, and fillers are real procedures. The second thing and final thing is, if you think something is wrong, if you don't feel right, trust yourself, trust your body, and make sure you reach out to get help.
Great advice, Lilly. So one last question. Are you swearing off fillers forever?
That's such a great question, and I wish I could honestly say, absolutely, I will never get filler again, but I can confidently say that in the short term. I don't know how I'll feel 5 years from now, 10 years from now, but for now, no fillers for me. Thank you so much.
You don't need anything, Lilly. You look great.
Thank you.
And so do you, Dr. Kelsey. Thank you.
Thank you.
Thank you to the both of you. This is a great learning lesson for all of us. Best of luck. Thanks for coming.